then I won't do it. I'm not going to keep forcing it.
I just want, if it gets bad, that's causing permanent damage in the past.
Okay, I understand. So if you relax your arm...
It's going very, very tight. So.
Okay, do you want me to take it off? Relax your arm. The tight.
I can't relax it.
The more tense you are, the tighter it's going to go.
I've got a problem with my hand. I can't do it with it.
Okay.
You
So at least pop your arm down if you can.
You see, it's too much. Putting too much pressure on my arm. Look at this, though. You know, it's made my arm explode before, right? I have to witness this because it gets too much, honestly. My hand explode, I'm going to put a big conversation in.
Okay.
It's getting too much.
Okay, do you want me to take it off?
Please. That popped when you pulled that off.
Yeah, because I pulled it off at here. So it pops because all the air comes out at once. Sorry?
I said abuse is not what I need, really.
I don't think I'm abusing you. I'm trying to check your blood pressure.
Well, that's how it hurt. I just wanted
and I asked you if you wanted me to take it off or use your other arm.
That happened before, and it's caused me white finger damage. It's very, very. I have to be very careful about what I do. I don't need no added problems.
No, I understand that.
I was told to get to the hospital. Now I'm being contradicted.
You're being assessed so that we can decide if you need to go up to the hospital.
You're actually contradicting 3 people. That's what you're doing right now.
I'm contradicting one person who's not clinically trained. Do you want us to assess you or not?
Well, of course I did. I didn't want patronising, bullying and hurting.
I don't believe I'm doing any of that stuff.
That's okay. Well, do you know what? I don't know if you've done. I understand like people frustrated with jobs, but I really need help, you know.
And I'm trying to help you. I'm doing an assessment so that I can.
Well, if things hurt, there have to be other options for patients.
And the option is to not do your blood pressure, which I've stopped doing.
I think you're taking advantage of my status as a single man, and you're trying to patronise me.
Okay. Do you want me to leave, Stevie?
Not really.
Because you don't sound happy.
I just like to help. Is what I do.
Okay. So to help you, I need to do an assessment.
Okay.
So can I check your temperature?
Yeah.
Yeah.
Yes, fine.
It'll just be in your ear.
I just said if something hurts, I can have to stop.
And we'll stop it. It's not a problem.
I'm already in critical condition.
Just in your ear, all right?
I thought you were going to check my leg then.
I will once I've done your temperature.
Just like.
Yeah.
I think you're probably right. I think I should probably take the battery and see how I get on for now. You're probably right.
So, without having checked your leg currently, that is my advice, but I will have a look at it.
You're probably right. I should just take the capsules, try and relax.
Am I right to have a look at your leg?
I thought that was the intention.
Yeah. Are you happy for me to have a feel of the leg?
Looks like bigger since you've been here.
Yeah. Are you happy for me to have a feel of the leg?
You're really stressing me out, man.
What is it that I'm doing that's stressing you?
I've got so much respect for you people, but I feel like I've got an emergency situation and I just didn't want to hurt, that was all, you know.
No, I understand
I don't want to patronise. I can do a job and I'm quite responsible. I don't need to patronise them. I know what's going on with me.
All I'm asking, Steve, is if I can feel your leg.
Yeah, please.
Is that okay?
Yes, go, please.
So I just need to feel the back of your leg.
Yes.
Tell me if it's painful.
Yes.
Is that painful at all? No?
It's not really painful.
Can I feel the other leg as well?
Yeah. Up here it is though.
I understand. Okay. So your swelling is from the knee above, and you say this area wasn't swollen yesterday, but it is today. Yeah. Okay. Fine. In terms of your numbers that we've been able to check, your heart rate is slightly increased, but that can be normal with an infection.
Because of this thing just made me panic.
Yeah.
You must understand what happened to me. It was really bad.
No,
now
I
I've got like
understand
this thing, I can't use it. My hands go numb when I hold anything from the last experience.
Yeah.
I don't know whether that was me or whether it was the machine, but that was not normal. Sure. They don't normally go when you pull them off. Because that pressure that went was going to be my hand. Yeah, and I understand that as a man because I've worked with pressure. Used to work with car pressure tyres, pressure valves, all that type of thing. So I understand that is going to cause serious harm.
And hence why we've stopped
That's what happened.
Okay. So as I said, your heart rate is slightly increased, which could be
I need to calm
because of
down
how
from
you're
what you're
feeling,
putting me through.
or it could be due to the infection.
This is what everybody else has been doing to me, patronising me.
Your saturation levels are absolutely fine. Your temperature is okay, and your calves and your lower legs are not swollen or painful, which is a really good sign. Now, I believe that the swelling that you've noted today could be due to the ongoing infection, and the antibiotics need a bit more time to do their job, essentially. Now, if it's been another 2 or 3 days and the swelling's getting worse, that would be of concern. It means the antibiotics aren't working, they might not be the right ones.
If the swelling, where, sorry, all over?
If the swelling to your leg gets worse still in a couple of days, I would say it could mean that the antibiotics aren't the correct ones for the infection that you have.
Okay.
So if it doesn't get better in a couple of days, I would get in touch with your doctors and see if they can give you some different antibiotics. Alright. I don't feel that there's anything that the hospital can do for you today. As I explained, the person you spoke with 111, they're not clinically trained, they are a call handler.
There's a lot of junior nurses and stuff like that. I've been through a very bad experience with people. They don't want to be at work, and I'm telling you what, I'm somebody who doesn't let people down when I go to work. When I did go to work, I'm a soldier. I don't leave people down, I don't patronise people. I would get on with my job. Unfortunately, I'm in a bad position where I'm having to rely on people, which is not good.
Frustrating,
at all.
isn't it?
Not at all. You find out who your family and your friends are when you're crawling on the floor. Then you'll find out later what they want to know about when it's like last night, all day yesterday, Dad calling the phone, Father, can you come to the hospital? I'm walking around the hospital bad. It's making me worse. Can you come around and push me around for a little bit? All day up to from whenever right up until I got home, because I needed him to bring me home also. Then when I got home, I got a phone call, the phone was on, it read the messages, and all of a sudden, I can come pick you up from the hospital now. Why is that? Because you know I'm home?
That's quite frustrating.
Because you know I'm home. And this is the type of thing I have to deal with, you know. And when you get something serious like this, obviously I appreciate it. Much help and as far as I can get, because I have to rely so much on myself.
Do you have paracetamol in the house?
Immature, very ununderstanding. When I think like somebody's on, like my father now thinks, no, because I'm signed on benefits, I shouldn't need no help enough. But when you can't go out shopping, you can't get out and nobody's doing anything, that money it's not even a lot of money. It don't matter.
If you can't do it yourself.
You can't do it, you can't, and someone can throw you £1 million. Well, you could start doing things, people, once you got that sort of money, they'll start doing it, obviously, but...
Do you understand my advice, Stevie?
Of course.
Are you happy that we've assessed you at this time, and I don't believe that there's any need for you to go up to the hospital at the moment?
Well, it's like this then, because since I was just suggesting, since I came back yesterday from about good 6 days of walking up and down on this and not very good sleep, would you suggest, do you think resting it now up and then getting some sleep?
So if it's swollen, resting, regular paracetamol for the discomfort and taking the antibiotics on time is the best thing that you can do.
That's all.
Plenty of fluids as well.
Everybody's been very misdirect with what advice they give you at the hospital. Oh my God. Sometimes I just couldn't believe what was going through up there, and even some of your own nurses were mean. They're saying we're sorry. I'm sorry, because I even wanted a plaster at one point, but I just cover. They didn't even have a small plaster on the whole ward.
Sometimes it's best to leave these things open to the air and not cover them necessarily.
That's
so that might have been it. So if they've not addressed it.
Holes in there, so what do you think? Are you very good with?
So we don't deal with these sorts of wounds. So we will assess you as a whole, sort of systemically, and you're showing signs of an infection, but not anything like sepsis or anything like that. So
not showing signs of sepsis.
No, not at the moment. You've got a very low risk of sepsis.
So this could all be to me struggling maybe, and
so the infection doesn't necessarily, because you're on the antibiotics, it doesn't necessarily mean you're automatically going to get better. So they need a couple of days.
That's by the way,
you're fine. So it might be that for today, maybe tomorrow, the swelling might get slightly worse. If it's a very marked swelling and it's a lot worse and it's really painful, it may need looking at again. But if it's just slightly increased, as you've said it is today, it's another area that's slightly swollen, it might just be the infection that's still present because the antibiotics need time to kick in.
Yeah.
Alright.
Would you be able to put on those records that you visited me, and if you say if things don't get changed, because you mentioned that I might have to go back for a change up there?
I will document everything I've said to you and everything you've told me as well.
Because a lot of people, I mean, the first day I got up there, I was like, can I be administered antibiotics straight away? Because obviously you know when you're infected and then the deal's done. It's a germ that multiplied. Especially this, and when I tell you this, I don't have to tell you this very, very disturbing detail. It nearly made the council cry, Stevie. I'm traumatised.
Okay.
Traumatised.
Yeah.
It's like a horror movie.
Going through a rough time at the minute, aren't you?
Yeah. Very bad, man. Very bad. I had to go back to the hospital for 1 day during that 9-day visit. And all I did on that first day was this toilet and bathroom didn't need an inspection and clean up for a long time. So the toilet doesn't flush properly sometimes. Okay. So between me going up to the hospital, coming home yesterday, and going to the toilet and having to leave it there due to me not having enough time to clean up and get out again with the ambulance, by the time I left that in the toilet and then come back home the next day, so within literally a day, I lifted the lid up and my feces was crawling with baby flies. Yeah. Crawling with. So whether it came out of my body, or I don't think something would have laid flies on and hatched that quick in 1 day.
It might have done.
Do you think so?
Potentially.
Can they hatch that quick?
Yeah.
They can lay on something and hatch in 1 day?
As far as I know, yeah. I wouldn't have thought it would have come out with you. Wouldn't have thought so.
So that's how quick it can lay one in you like that, isn't it? But you don't think, like from that then, because I'm sure if they were, they would have been maggots, wouldn't they?
Yeah, probably, maybe. I'm no expert in terms of those things, I couldn't say for sure. If they would have formed in the toilet in 1 day when I come back, but if you say they can form in 1 day anyway, it's a little uncertain, isn't it? Yeah.
It's very
Could be
uncertain.
either or.
Sounds like I feel something inside me is trying to get out.
Okay. If, as I said, if your leg gets slightly worse, I'd get in touch with a GP in a day or 2, or 111, depending on what time it is, and say to them, you know, I think I need some new antibiotics, I'm not getting any better. If things are markedly worse, so very severe, you can always give us a call back, and at that point we would probably take you up to the hospital. Alright, Stevie? Yeah. Have you got any questions at all?
Just scared.
Yeah, I understand that, but hopefully in a couple of days you start feeling better with his antibiotics.
Very scared.
Yeah. Alright, Stevie?
Thank you.
Yeah, not a problem. We'll leave you to it.
Sorry about the misunderstanding of that thing. I had a very bad experience with it.
I understand.
It sort of crippled me.
As I said, if you do need us again, give us a call back. And if you're not any better, have a chat with your GP.
That would help outreach, unfortunately, but yeah.
Alright, Stevie?
So this lady over the phone, she said, look at your hands as well. If they're grey or...
Yeah.
I think they've got a sort of grey tinge to them.
You're a good colour. You're a good colour. You look well perfused.
You've got a darker eyes though.
Yeah, I know that, but centrally, so your face and your nail bed, you look a good colour.
This has changed my life.
And your oxygen levels are very good.
This has changed my life, hasn't it?
Yeah. Sounds like it's been a very rough time
my
for you.
My nails are dirty because I ain't got bleach or nothing at the moment.
Yeah.
It's just dire straight.
But we assess your nail beds for your circulation and they're a good colour.
Yeah. Please watch out for those things when you go
Sure,
out the door.
not a problem. Right, Stevie, take care.
All the best.
Thank you. Yeah, really watch out for those things.
Yeah, we will.
There's been reports they're trying to get them to
I'll let you shut the door because my hands are full.
Thank you.
Take care.
Fuck about now.